Good morning to all those who make this broadcast possible, to Gisela, to our sign language interpreter, and good morning to everyone tuned in to this briefing. Today, 6,981 people are hospitalized in Cuba. 2,894 are under observation. There are 774 suspected cases and 313 confirmed active cases. Yesterday, we processed 6,725 samples in our various molecular biology laboratories. Of the 6,725 samples processed, 30 tested positive for COVID-19. That's 30 people with the virus. This brings the total number of samples processed in the entire country since the pandemic began to 691,743, of which 5,978, or 0.86% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. From Pinar del Rio, 110, the most from Havana with 4,292, Mayabeque, 172, Matanzas, 170, Cienfuegos, 164, Villa Clara, 370, Sancti Spiritus, 766, Ciego de Ávila, 630, Camagüey, 110, Las Tunas, 86, and so on and so forth from all of the country's territories. All of the 30 positive cases diagnosed yesterday are Cubans. 8 of these are also imported cases. 19, or 63.3% of all confirmed cases yesterday, are confirmed case contacts. It has not been possible to determine the source of infection in 3 cases diagnosed yesterday. Yesterday, 8 people to have tested positive for the virus contracted it abroad, meaning that imported cases rise to 455. Of the 30 cases diagnosed yesterday, 17 are female, representing 48.9% of all diagnosed cases, while 13 are male, representing 51.1%. 19, or 63.3% of the 30 cases diagnosed yesterday were asymptomatic at the time of testing. 67.3% of cases diagnosed over the last 15 days showed similar behavior. By age group, 2 positive cases diagnosed yesterday are under the age of 20. Both are in fact under 18 years of age, for a total of 668 children, or pediatric cases, to have tested positive for the virus in Cuba. Of these, 92.8% have recovered from the virus and been discharged from hospital. Meanwhile, 10 people to have tested positive for COVID-19 yesterday are between 20 and 39 years of age. 14 are between 40 and 59, and 4 are over the age of 60. Of the 30 cases diagnosed yesterday, 1 belongs to Artemisa and is an imported case. 9 belong to Havana, one of which is imported. There is 1 imported case belonging to Matanzas, 14 autochthonous cases belonging to Sancti Spiritus, 1 imported case which belongs to Holguín, 2 other imported cases belonging to Granma, 1 imported case to Santiago de Cuba, and 1 imported case to Guantánamo. The imported case from Artemisa belongs to the municipality of Bahía Honda. The 9 cases from Havana belong to the municipalities of Regla with 4, San Miguel with 2, one of which is imported, and 1 case each to Guanabacoa, Arroyo Naranjo, and Habana del Este. The one imported case from Matanzas belongs to the municipality of the same name. The 14 cases from Sancti Spiritus belong to the municipalities of Sancti Spiritus with 10, Trinidad 3, and Cabaiguan with 1 case. The imported case from Holguín belongs to the municipality of Cacocún. The 2 imported cases from Granma belong to the municipalities of Cauto Cristo and Bayamo. The imported case from Santiago de Cuba belongs to the municipality of Mella, and the other imported case from Guantánamo belongs to the municipality of the same name. Given yesterday's results by province, Ciego de Ávila continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 43.47. Sancti Spiritus follows with 33.48, then Havana with 8.71. Matanzas has a rate of 1.39, then Artemisa with 0.58, Mayabeque with 0.52, Pinar del Rio 0.51, and Villa Clara with a rate of 0.26. No new cases of the virus have been reported in the provinces of Camagüey, Holguín, Cienfuegos, Las Tunas, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality for the last 15 days or more. Cuba's rate therefore stands at 4.93 per 100,000 inhabitants over the last 15 days. To summarize, of the 5,978 people who have been diagnosed with the virus thus far in Cuba, 313, or 5.2%, are active hospitalized cases. Of these, 308, or 98.4%, are clinically stable. Yesterday, no one died as a result of the virus, meaning that the COVID-19 death toll on the island remains at 123, with a mortality rate of 2.05%, lower than the global rate of 2.89% and the regional rate of 3.30%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 100 people were discharged from hospital, a positive result when compared with the number of confirmed cases yesterday. 24 people were discharged from hospital in Havana, 1 in Matanzas, 14 in Sancti Spiritus, and 61 in Ciego de Ávila. This means that, to date, 5,540 people, or 92.7% of all confirmed cases in Cuba, have recovered from the virus. Today, 1 patient continues to be in a critical state in hospital in Villa Clara, while 4 patients are reported as serious and being treated in hospitals in Camagüey, Villa Clara, and Havana. Yesterday, 3 new patients joined the group of those reported as serious, and 1 serious patient passed to closely monitored. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 358,567 people were diagnosed with the virus, for a total of 36,941,677 confirmed cases since the start of the pandemic. Yesterday, 5,966 people died of the virus worldwide, for a total of 1,068,944 COVID-19 fatalities, and a mortality rate of 2.89%. The region of the Americas, which accounts for 48.32% of all cases worldwide, reported 130,900 new cases yesterday, for a total of 17,952,981 people to have been diagnosed with the virus. Meanwhile, 3,105 people died of COVID-19 in the region yesterday, for a death toll in the Americas of 590,152 and a mortality rate of 3.30%. The United States continues to top the list of countries worst affected by the pandemic, with 7,664,676 confirmed cases and 213,787 COVID-19 fatalities. Then comes India with 6,979,423 cases and 107,416 deaths. Brazil follows with over 5,056,000 cases and 149,639 fatalities. In fourth place comes Russia with 1,272,238 confirmed cases and 22,257 deaths. From the Americas, after the United States and Brazil, comes Colombia, Argentina, Peru, Mexico with a high mortality rate of 10.31%, Chile, Canada, Ecuador, also with a high mortality rate, standing at 8.35%, Bolivia, Panama, the Dominican Republic, Guatemala, Costa Rica, and Honduras. These are the 15 countries with the highest number of cases in the region. Meanwhile, Cuba occupies 21st place on this list. This is the information we have on the behavior of the pandemic in Cuba and the world.